Rick's excited to be here. Thank you for being with us this evening. So I'm the Chief Executive, CEO here for St. John's, and it's an honor for me to be here to provide just a little bit of introductory remarks, most importantly to express gratitude for all of you coming out to learn a little bit more about our amazing Pacific Neuroscience Institute. So tonight we'll cover a lot of things, and Dr. Kelly is going to talk to us a little bit more about that. But it is something, if you think about it, there have been some remarkable achievements by our Pacific Neuroscience Institute, who are considered, I would consider them to be visionary leaders who've truly made a profound impact on the world of neurosciences and throughout the world, I will tell you as well. So pretty awesome that, again, St. John's Health Center, this is one of a handful of examples of where literally we've impacted the health of the entire world. Not just, Santa Monica, not just the West Side, but this is because of some of the amazing work done by the clinicians that you're going to meet tonight. And tonight we will have the privilege of showcasing a few of our clinical programs and services that are a part of P&I. And again, we rattle off P&I like it's just this, word in and of itself, but it's obviously an acronym for Pacific Neuroscience Institute. So Dan and I were just talking, Dr. Kelly, about when actually P&I was formed. I always say 2017, which is when it was kind of officially formed within Providence. But over at a bar, I understand, in Kansas in 2014 is where it really started. And Dan will tell you a little bit more about that. But obviously, if you didn't know, P&I was established with 4 kind of founders, if you will, led by Dr. Kelly, but also other doctors that I think at least one of them is here, if not others. So Dr. Chester Griffiths is here. Chester, wave your hand. Stand up, Chester. Chester's a little ticked he's not speaking tonight, but we tell him he has plenty of opportunities to speak. So thank you, Chester, for being here. We also have Dr. Howard Kraus, who I did not see. We will no longer consider him a founder since he didn't show up tonight. And just kidding. And Dr. Santosh Kesari. Some of you that don't know Dr. Kesari, Dr. Kesari is an internationally accomplished medical oncologist. So we are in great hands by these 4 founders. Again, Dr. Kelly, Dr. Kesari, Dr. Griffiths, and Dr. Kraus. And under Dr. Kelly's leadership, these founders have demonstrated an unwavering commitment to advancing neurosciences and have positioned St. John's, as I was saying earlier, at the forefront of cutting-edge research, innovation, and patient care. Through P&I and all of its physicians, which I think are coming close to about 40 now, we've witnessed the transformation of neurosciences not only here in Santa Monica, but as I was saying earlier, throughout the state of California and even beyond. Our commitment to brain health is exemplified by the Pacific Neuroscience Institute Brain Health Center under the leadership of Dr. David Merrill, who is just to the left of, or to your right, Dr. Kelly. Thank you, Dr. Merrill, for being here. This center stands as a beacon of hope, dedicated to promoting cognitive wellness and providing comprehensive care for many neurological conditions. Dr. Merrill's expertise and passion have created a haven for those seeking answers and solutions to in the realm of brain health. Additionally, beyond to the left, your right of Dr. Merrill, I'm proud to introduce the Pacific Movement Disorder Center, led by the accomplished Dr. Melita Petrossian. Melita, thank you. As some of you know, this center specializes in the diagnosis and treatment of movement disorders, offering a lifeline to those affected and their families. Dr. Petrossian's dedication to improving the lives of individuals with movement disorders reflects our commitment to comprehensive and compassionate care. And last but not least, at the end of the line, in the realm of auditory health, we are privileged to have Dr. Courtney Voelker with us tonight. By the way, Dr. Merrill, they beat you on the wave. I saw your wave. They got the wave down. So Dr. Voelker, as many of you know, is the director of our adult and pediatric cochlear implant program. Her expertise and commitment to restoring the gift of sound to those with hearing impairments have brought joy and connectivity to countless lives, not only individually, but also for their families. So tonight we gather not only to celebrate these outstanding individuals and programs, but to emphasize the critical importance of education, awareness, and access to high quality care within our own community. By supporting our clinical institutes like P&I, we contribute to the health and well-being of the West Side, ensuring that our friends and neighbors have access to world-class health care right here in our very own backyard. To our generous donors, your support fuels our mission and enables us to reach new heights in healthcare excellence. To our grateful patients, your stories inspire us every day, reminding us of the profound impact we can have on those lives that we serve. In closing, let us all continue to champion education, raise awareness, and provide accessible, exceptional health care. Together, we really are building a healthier, more resilient community. Thank you for being with us this evening as we learn a little bit more about P&I, and for partnering with us as we continue to make strides in the pursuit of excellence in neurosciences. And with that, I will turn it over to Dr. Dan Kelly.
Thank you, Michael. It's great to see everyone here. I want to thank Sheryl Bourgeois, who I'll introduce later as our new President and CEO of the St. John's Health Center Foundation. You know, P&I has had a really interesting journey, I would say, a road locked arm in arm with St. John's Health Center. And it has been really a team effort, a collaboration with the foundation, with all of our amazing doctors, with our founders like Dr. Griffiths, Dr. Krause, and Dr. Casey, and now all of our center directors. And I think it's good tonight we're going to focus on brain health, but I'm going to give you a little bit of the history of P&I that Michael alluded to, that we haven't been here for that long. We're a bit of an anomaly. We consider ourselves private-demic, given that many of us came from formal academics like the University of California, but we're very involved in research and education, fellowship training, and that has been a big part of our mission here, and that's why we're so dependent and collaborative with the foundation, because to do this kind of work in a non-traditional academic setting, you have to have the support and the contribution of philanthropy. And we've been very, very lucky and successful. You know, when we started, as Michael said, when we joined forces with Providence back in 2017, we had 17 doctors, and now we have 40 plus. And we've grown tremendously. And where we started, very important to realize, we started basically in the realm of brain tumors, pituitary tumors, tumors of the skull base. And that's where Dr. Krause and Dr. Griffiths and I and Dr. Casey really started. But then as we were here, we saw this really important need for other things, and very much for like stroke. Like you just heard a code stroke being called. That was very good timing. And we expanded out into stroke. We expanded out into hydrocephalus, to facial pain. Actually, Dr. Petrossian was in on the beginning in 2017, but it wasn't until 2018 when we really started thinking about, we need a brain health center. This is an area that could really be, we need a lot of work in this area, in the area of cognitive decline and dementia. And a lot of our patients with brain tumors, with strokes and hydrocephalus, they develop cognitive decline as well and cognitive problems. And so, again, through the support of the foundation, they helped us launch this Brain Health Center. We were very fortunate to recruit Dr. David Merrill and a number of other talented neurologists like Verna Porter and Bill Buxton. And this grew tremendously. We've been very fortunate with philanthropy over time. And so tonight, as Michael said, we have a lot going on in the center. We're very fortunate to be able to do this tonight. In September, we're going to feature a bunch of the other centers of excellence. But tonight, we're going to really focus on brain health and understand what our mission is here, how to weave together a multidisciplinary group of clinicians that look at brain health, cognitive decline, dementia from very many different angles and try to come up with novel solutions. And I think we're definitely starting to move the needle. And we want to give a shout out to Carrie and Will Singleton for their support, but we need more support, and it's growing over time. So tonight, what we're going to do, we lost one of our speakers, Dale Bredesen, who you may have heard of, who wrote the book, The End of Alzheimer's. Dale has joined our group and is with us, but Dale had a herniated disc today and is flat on his back, and he's not going to join us, so Dr. Merrill and the team are going to extend their sessions a little bit. But we thought that it would be a good discussion here to talk about what we're doing in terms of cognitive health and longevity, and how it relates to movement disorders. You're going to hear from Dr. Petrossian, because a lot of patients with Parkinson's disease, for example, as you'll hear, have cognitive decline as well. And then the sort of foundational importance of our senses, and particularly hearing, as it relates to cognitive health. And that's why we have Courtney Voelker here. And this is part of the secret sauce, the specialness of P&I, where we have this intertwining, interdigitating subspecialties that make the sum much bigger than the individual parts. And that's really what we're trying to present to you tonight and to emphasize to you tonight. And you know, it's sort of the trickle down theory of brain health is really, you know, you're not going to have a healthy body if you don't have a healthy mind. And this is what we're trying to achieve here at P&I. So I'm going to turn it over to Dr. David Merrill now, who's a geriatric psychiatrist. He joined us in 2018. He leads the Pacific Brain Health Center. He's a brilliant guy, and he's going to talk to you about how to save your mind and preserve it and stay smart and funny for years to come. Dr. Merrill, no pressure.
Thank you, Dr. Kelly. And for those of you who are hoping to see Dr. Bredesen tonight, that makes two of us. So no, he sends his regrets, and he'll be with us again soon. And next time he's gonna pull through. He's gonna make a full recovery. So in all seriousness, I've known Dale probably now for about 15 years. I was one of the first faculty members. We were together at a university on the West Coast that shall remain nameless. That's how we first got to know each other. There was actually a family that I was taking care of. They were facing the threat of the big A. And they turned to me for help with my colleague, Dr. Karen Miller, who happens to be in the crowd tonight, for us to help ease the way, ease their journey through. Really, it's a journey that's continued with the family, like many of the families we care for over the last 20 plus years, knowing Dr. Miller going on. So in any case, long story short, Dale came along and he started putting together the science with clinical outcomes. And so really, day in, day out, I'm directing the Brain Health Center, like Dan said, but it's not me. I mean, there's a whole team of 50-plus members that we're all working together in concert to help improve outcomes of persons who are going through the process of becoming older, the aging process, the aging. So I like to say I study the aging brain and how to achieve best outcomes, how to achieve successful aging as we become older, from our midlife to older adulthood, into our 60s, 70s, 80s, and beyond. And so really, back in 2018 when I first met Dan, it was kind of like he had me a hello. So I had actually been in the UC system since the tender age of 18. I went to UC Berkeley, studied neuroscience, UC San Diego, studied neuroscience, went to med school, went to UCLA, studied neuroscience. You get the picture. But anyways, I thought I would never leave the UCs until I met this man. So he is truly responsible for me being here tonight, and I thank him. I also would like to thank that family that Dr. Miller and I took care of together for all these years. They were actually the first grateful patients that I ever had. No, I mean, in terms of being donors, I apologize. So it surprised the heck out of me. I was like just going along, minding my own business, and I got this email. I get so many emails. I'm like, okay, I'm going to reply to this one. And it was like, Dr. Merrill, we've thought about it, we decided we want to give you $1 million to do whatever you like, because you're so great. And like, you helped us so much, and it really means the world to us what you're doing with our family, and so we'd like to contribute. And I was like, wait, this has got to be a scam. So I put in my social security number. No, I'm just kidding. No. So that really became true, and the story evolved from there. This was back at UCLA. I was quote unquote junior faculty. I was in my adolescence. I was very rageful, still like, oh, come on, I'm Dr. Merrill, come on. Anyways, so I was kind of going through developmental fits and starts. And so the family, I was telling them, you know, guys, I know you gave me $1 million. It's a lot of pressure. Never had that kind of money before. Humble beginnings. And so they said, you know, Dave, just do what's your passion. And I really came to learn that healthy brain aging, I'll get back to that in a second. So anyways, come to find out, the family has 4 children, and all 4 were born at St. John's. And so when I was really trepidatious because I met with Dr. Kelly. It seemed great what they wanted to build here. And I was nervous about the family that had supported me. And I was like, you know, guys, I know you love the Bruins. Go Bruins, yay. And so I was like, well, there's an offer I don't think I can refuse. There's this great community hospital down the way, and they're doing good things, and I want to join forces with them. It's St. John's. What do you think? And needless to say, I'm here. They embraced it. They came. They renewed their pledge here at St. John's. They support Dr. Linehan, myself as well, and urology. Yes. So, I mean, the rest is kind of history. It's made all the difference. Coming to St. John's for me has made all the difference. I had a cognitive. You don't know this, Dan, but before the Brain Health Center, I had a cognitive health clinic for 5 years. It was one-man band. I was the psychiatrist, neurologist, occupational therapist. I was like all by myself. You've heard that song. I'm not going to sing it. But anyways, once I came over here, it was gangbusters. We were running deep from the get-go, and now we're up to 50-plus members. We have neurologists, psychiatrists, neuropsychologists, social workers, care managers, nurse practitioners, whom I forget. We have a whole rehab department now that we've started because of the support of our grateful donors, the support of the St. John's Hospital, P&I. We're killing it. We're doing a really great job helping families as they're becoming older face the difficulties that develop with aging. And so, that's the backdrop of where I'm coming from, is that we come together in the outpatient clinic. We're at 1301 20th Street, and we're here to serve. We're helping those who are at risk for or with the beginnings of memory loss syndromes and other neurologic conditions. It's a beautiful part. As I started out as someone primarily treating and researching persons living with Alzheimer's, but now I've realized that all the neuroscience service lines, all patients and all persons living with neurologic health stressors have cognitive needs or cognitive care needs. And so I think that actually leads right into the story. And I'm going to be here for all the Q&As. I'm going to spend a couple more minutes I'm going to do Dr. Bredeson's part now. Get ready. Hi, everyone. I'm Dr. Dale Bredeson. So in any case, before I introduce Dr. Petrossian, who runs our Movement Disorder Center, I'm going to talk for a few minutes about how we do brain health for persons at risk for or the beginnings of Alzheimer's disease. So I like to start with something called the Precision Brain Health Protocol, which is built off Dr. Bredeson's work, where what we're really doing is we're trying to identify the hidden drivers of dementia. So there's been a lot of wishful thinking that Alzheimer's could be simple, that we could just find the enemy, target the enemy, and take it out. But truth be told, that Alzheimer's doesn't really care what we want it to be or how we want to deal with it. The reality is that it's very complex, but the solutions turn out to be simple. And so what I mean by that is not all cases of Alzheimer's can be prevented. Not all cases of Alzheimer's can be reversed. But we now know that what we do day to day matters. And that's a huge difference. That's a huge shift in thinking, even from when I began training. Now we know that you can help yourself get better. And so the foundational lifestyle activities, we have a health and wellness lifestyle program at Pacific Neuroscience now, where you can come be social, do cognitive training with Dr. El Hilu. You can do fit brain training with our brain health trainer, Ryan Glatt. You can do memory care programs with Dr. Karen Miller. She's brought that over from UCLA and evolved it and improved it. So you can do a lot of social, cognitively stimulating things that help your mind. I shouldn't leave out nutrition, so we have an on-staff dietitian, Molly Raposo, who she's with Dr. Bredesen tonight. I hear they're having a great time. So just kidding. So it's really the foundational lifestyle activities of the Brain Health Center are where things start. But then beyond that, there's really the biopsychosocial spiritual model of whole person care. And so he's not here tonight, but I met at least one longtime patient of Dr. Bill Buxton. Dr. Buxton's not here tonight. The person, anyways, you get it. So Dr. Buxton is actually a neuromuscular neurologist he likes to say, I do below the neck neurology, but now he runs a spirit builders group. We have a neurologist running a spirit builders group. How about some applause for that? I mean, to me, this is like the most amazing thing. It's an act of, it's a good thing. So Dr. Buxton's running a spirit builders group for persons who are struggling with just living and being together. So it's a social group. It's a place. Brain health is an experience more so than it is a medical clinic. It's also a medical clinic. So the part which I was kind of skipping over, I do this precision brain health process, which is really intensive. It involves a lot of nights and weekends of me looking at spreadsheets and lab data and trying to help people get better. And so it's like I could have had a really easy career. I could have just prescribed Prozac and be done with it. I'm a psychiatrist by training. Just like I could be like, did I go to med school? I can't remember. But no, like I'm in the trenches trying to practice medicine day in, day out, trying to help address causes of chronic inflammation in the body, trying to optimize people's metabolism, pushing back against things like prediabetes, overweight, obesity. I'm looking at hormone levels and vitamin levels. These are measurable in the blood now. And so I've gotten the reputation, I think I may have single-handedly broken the St. John's outpatient lab. I've gotten the reputation of being a vampire. So come to see me and I'll send you for like 15 vials of blood to then get biomarkers that we then optimize for your health. And it turns out when you optimize your body health, your brain health improves. And so we've seen person after person, family after family benefit from this approach that involves curiosity. Try to figure out not just that you have a condition, but why is it happening? And how can you make it slow down, or how can you make it better? So I think Dr. Bredesen would have had slightly different ways of saying this. It would have been like, Alzheimer's is a network insufficiency where the energetics are not optimal, because he's like this wizened scientist, and I really look up to that. And day in, day out, I try to carry out his vision, this mission of achieving the best outcomes possible for persons living with or at risk for dementia. And so we started the Brain Health Center focused on Alzheimer's disease, dementia, how to slow it down, how to prevent it. But from there, it's grown into the recognition that there's other neurodegenerative disorders, other causes of brain disease that we face as we age. Chief amongst them is Parkinson's disease and associated Lewy body dementia syndromes. And so that is where we've actually married this concept of optimizing health for avoiding and slowing down Alzheimer's, but to also try to apply it to other conditions, first and foremost of which is Parkinson's disease. And so it's my pleasure to invite up to the podium to discuss the life-changing work that Dr. Melita Petrossian is doing with her patients and their families. Whenever I see her patients, we take the first half of the session talking about how great Dr. Petrossian is. And I'm like, well, she's already doing everything, but thanks for coming in. No, really, you could have been a great psychiatrist. So anyways, Dr. Petrossian is going to talk about the Movement Disorder Center at P&I, where she's doing groundbreaking work, both clinically in terms of research for addressing Parkinson's. Please.
Thank you all for joining us this evening. Thank you for the invitation to talk about what my experience has been and what we're trying to do at the Pacific Movement Disorder Center. I'll start by giving a little bit of a background about myself. I'm also somebody that was poached from the university that shall not be named. Back in 2016, I was approached by Dr. Kelly through a family member, we'll say. My brother is Dr. Garni Barkadarian. Many of you may know him. So this isn't nepotism, I swear. So I met with Dr. Kelly to create the Movement Disorders program here at St. John's. And I started by myself, as well as our surgical colleague, Dr. Jean-Pierre Langevin. Sorry, Jean-Philippe, I said Jean-Pierre. So started really by myself, actually kind of an island in the cancer center, because as Dr. Kelly mentioned, P&I started as a brain tumor focused institute. So my office was in the St. John's Cancer Institute and my clinics was in the cancer center, until we were able to grow and bring on a nurse practitioner, a second movement disorder specialist in our Torrance location at Little Company of Mary, bringing on our social worker, Sheila Moore. And then when brain health came into being, it just made more sense for me to be with my people and be with the neurologists and the psychiatrists doing work on preserving brain health and preventing dementia. So that's how I became part of this amazing team, and I'm so grateful. And I'll talk to you tonight about what we do kind of in the eyes of somebody who's coming to see me for the first time, and what the journey is that I hope to provide people, because I've certainly hoped to provide the type of care that I would want for a family member. So a lot of people who come to see me for tremor, they're not sure what it is, or a gait disorder, they're not sure, they're a little bit worried it might be Parkinson's, but they don't know. Maybe they've seen other neurologists, maybe they've seen a primary care doctor. And so first and foremost, of course, is the accuracy of the diagnosis. And that's one thing that we're doing here that really goes beyond what can be provided at other locations, which is biomarker testing to evaluate for Parkinson's disease or rule it out as the case may be. So, for example, we use DAT-SCAN, which is available here at St. John's. It's a dopamine transporter imaging system that can measure dopamine levels in the brain. But beginning in 2020, we also started providing a type of skin biopsy that evaluates for the abnormal protein that causes Parkinson's, which is called alpha-synuclein in the nerves of the skin. So we can actually diagnose Parkinson's and dementia with Lewy bodies, which is related, as well as some other conditions like multiple system atrophy, using a skin biopsy, which is sort of a window into the brain. So we start with the diagnosis. Patients who are diagnosed with Parkinson's tend to be very overwhelmed and concerned and feel devastated by the news. So we start by talking about what can people do, what can they do to keep things at bay, to help themselves feel better and prevent decline as much as possible. And we talk a lot about exercise. I'm a big believer in the role of exercise for preventing progression of Parkinson's, because there's more and more data that it actually slows progression in the brain. You can actually see something which is called BDNF, which is a neural factor, actually slow the progression, the spread of the alpha-synuclein pathology from cell to cell within the brain. You can see people utilize their dopamine more efficiently, create new synapses within the brain, Exercise promotes angiogenesis, which creates new blood vessels in the brain, and it's good for bone density and muscle bulk as well. So we talk about exercise, we talk about nutrition, the importance of that. But beyond that, we can actually connect people within PNI to people who have expertise in guiding them on that. Of course, there's physical therapy. There's physical therapy in a lot of places, but what we have here are neurophysical therapists. They're physical therapists who specialize in neurological conditions like Parkinson's, like gait disorders, and we are going to be soon joined by neurooccupational therapists, which I'm really excited about. We have speech therapists who work on people's symptoms of voice issues, which are common with Parkinson's, cognitive symptoms, language complaints, and swallowing disorders, which are all, unfortunately, can be common with Parkinson's disease. So we have this multidisciplinary team, and we have conferences every month discussing our cases, so we're really side by side with each other. It's very different from other places I've worked where you're sort of isolated from the other members of the team. You know, you kind of know they exist, but you don't get to have those conversations. So this is a really great opportunity here. In addition, with the exercise piece of things, we have our Fit Brain, which is an amazing opportunity for patients to actually exercise their brain with their body. So this is something that Dr. Merrill's team has been working hard on. And yes, Ryan's all the way in the corner there, Ryan Glad, definitely very much a champion. All of my patients who've ever worked with Ryan say he's like the best cheerleader. He's very enthusiastic. Really, you know, what's really interesting about cognitive physical dual tasking is you can retrain your brain to connect back to your body, which is a big thing for Parkinson's patients because they really need to rewire their brain to use their body better because of how Parkinson's works. So it's right upstairs on the third floor of the 1301 building, really cool equipment. But Ryan's also, and his team, they're all really great at not just helping our tiny little community here, the small number of people who are able to drive into Santa Monica, but also thinking about how do we scale this out? How do we make this something that's available at home or in other places? So that's a lot of the work that's been really exciting here at PNI. So we talk about all these things, but people are also still a little bit feeling, you know, uncertain, and they have questions. So at PNI, we've been lucky to affiliate with the American Parkinson Disease Association, and with that group, we've brought to our community a program called Parkinson's Roadmap for Education and Support Services, PRESS. And what this is a free program for people who've been recently diagnosed and their family members. We run it quarterly with our nurse practitioner, Giselle, who's amazing, and our social worker, Sheila, who many of you know, she's also amazing. So providing guidance, education, but also a support group for people who've been recently diagnosed. Because these are people who are struggling with, what do I do? This is overwhelming. I don't know where to turn. I don't know what to do. And so having a curriculum, having a closed group where they get to know people within their group, and we've had, and they go for about 8 or 9 sessions and then they graduate. And we've had some groups where those patients have stuck together and they have like a monthly dinner and they get together and they just hang out, and their connection is that they were impressed with our group here. So we've been really seen a huge improvement in people's comfort levels with the diagnosis and kind of understanding what they need to do next. So as the person with Parkinson's or related condition is going on in their journey, we really emphasize, you know, the accuracy of the medications, how we're adjusting things. That's very important, along with their exercise that they're doing, their physical speech therapy. But we may have some patients where medications aren't enough for them, so they may need deep brain stimulation surgery or other advanced techniques. So we have our director of our neurorestorative surgery program, Dr. Langevin, who is able to implant deep brain stimulation electrodes to control the symptoms of Parkinson's and essential tremor in certain cases. And this has also been really an amazing time because there have been so many advances that have been made in these technologies, and now we have the ability to sense the signals coming from the brain to more accurately target those abnormal signals directly. And so that's been a very useful tool for some of our patients. Unfortunately, as people are dealing with Parkinson's, sometimes they may also be struggling with issues of cognitive or psychological difficulties. It's very common with Parkinson's. Depression, anxiety, cognitive complaints. So being at Brain Health has allowed me to literally go down the hall and, pick Dr. Merrill's brain, or I'm next door to Dr. Stella Panos. She's our neuropsychologist, and she's done neuropsychological evaluations along with the rest of her amazing team. We offer neuropsychology testing in Spanish, which is really an important thing. And so, to have that kind of relationship, it's so different from other places I've been where, again, the psychiatrist is way over there and, the psychologist, forget it, you can't even meet the psychologist. So it's really been a huge improvement in the quality of life of our patients to have that access to therapy, psychiatrist, transcranial magnetic stimulation. Dr. Merrill didn't mention that program that we have here for that, which has been really helpful for people with depression. So that's been a huge boon as well. And then we also have, some patients who are maybe struggling more as the disease is progressing, and we have support groups led by our social worker for patients, as well as a separate support group for caregivers. So we've been really glad that people have felt supported in their journey. That's our goal. And of course, as Dr. Merrill alluded to with the lifestyle program, we've been developing sort of an offshoot of that that's more specifically geared towards Parkinson's. So I really thank Sheryl and Dr. Miller for their enthusiasm for creating this program. So we're just getting these things off the ground, but it's been amazing to be able to offer these things. And really, what we're hoping is that it's really a kind of a one-stop shop for everything Parkinson's. With that, I'll turn over to Dr. Voelker. Certainly, we have a lot of people with with language and communication complaints with Parkinson's because the voice gets a little soft. And then I get to Dr. Merrill referred to me as a psychiatrist, or I could have been a psychiatrist. I feel like I am a psychiatrist. I'm also a marriage counselor, apparently, because I get the patient who's talking very softly, and then they're like, no, there's nothing wrong with my voice. It's you, it's your hearing. You can't hear me. So I'm always like, well, maybe it is your hearing. Maybe you should see Dr. Voelker because she can help you with that. So it's probably somewhere in between that. But with that, I'll hand it over to her.
So thank you all for giving up your evening to come hear from us. I'm Courtney Voelker. I lead our P&I cochlear implant lateral skull base program, and I broke the mold. I'm not from California. I'm from Oregon, up north. I did all my training on the East Coast in neuroscience. I'm really a neuroscientist by nature. I did my doctorate at the University of Oxford, really studying how neurons are born in the brain and how neurons are programmed to their specific function. And in medical school, when I learned about the cochlear implant, which is our only sensory brain interface device in medical history that can restore a sensation, I was sold. So I said, that's what I want to do with my life. And I was recruited by Chester Griffiths, one of the founders, it will remain a founder, because I was the director of lateral skull base surgery at University of Southern California across town for many years. And I was really understanding why we're really not reaching the masses of people who need hearing health, because I was very siloed in the Department of Otolaryngology, ENT. And what I really was looking for was to take innovation out into the community to reach the masses and to be a part of a really innovative group of surgeons, doctors, caregivers that can really go to the next level on brain health. How does hearing health affect brain health? We now know that recent evidence shows that hearing is the #1 contributor to cognition and cognitive decline. When you measure people's cognition at time 0 that have hearing loss, no matter how old they are, no matter what their level of hearing loss is, and you actively treat that hearing loss with either hearing aids or cochlear implants for as little as 6 months, and you retest cognition, almost 100% of people's cognitive scores improve. This is a #1 modifiable risk factor that we know about. And how many people in the audience have had an audiogram? Raise your hand. Okay, good. Yay. So, but we still have some work to do. So I have started, I feel very blessed. I get to work with babies who are born all the way, so birth to twilight. And those are all my patients. I have started doing cochlear implants as young as 5 months. FDA approves 9 months, but those families who are very educated in hearing loss will often come because they know that we're very aggressive. We know neuroplasticity. Why are we waiting for these little neurons in their brain when they need to be getting language acquisition? And then all the way up into adults and our geriatric population, I've shared one of these statistics with you, but from the time either a patient or a family member, often the spouse, notices hearing loss, it is often around a decade before that patient will be fit with hearing aids. We would never let people walk around with blurry vision of any amount. I see all the glasses on, including my own. But we let people walk around with blurry hearing. Why? Why are we doing that? Think about what that's doing to the neural pathways and the atrophy of all those neurons in the brain. And that's why I feel very blessed to be part of this overarching theme of professionals really trying to tease out brain health. And so that's my contribution. What is a cochlear implant? So who's a candidate for a cochlear implant? We all have Aunt Sally who is on their 9th pair of hearing aids and shoves them in the drawer and doesn't want to talk about it, and everybody's yelling at her. She probably needs a cochlear implant. Everybody wants to hear. It's not her fault. They're not working. She can't understand. She can't participate. Hearing loss leads to social isolation, depression. I hear family members, yelling at their loved one in the office visit, the doctor's trying to talk to you, pay attention. It's not their fault. Everybody wants to hear. And so if you know anyone who has a hearing aid and they're not doing well, that's a person that needs to come in. And we do testing because we have more technology to offer. Only 5 to 7% of adults who need a cochlear implant in the United States get a cochlear implant. Let me repeat that, 5 to 7%. We're only doing 20,000 implants in the United States, and a recent study came out at Johns Hopkins that it needs to be about 2.5 million people. So I have a lot of work to do. Good job security. But the last thing I'll say is we are really going out into the community I'll talk to anybody who wants to listen, primary care doctors, neurologists, audiologists, to educate about hearing health. And then also research. We are really linking with Dr. Merrill's group, Karen Miller, to really be on the cutting edge of how hearing health impacts cognition. So not only how are my cochlear implant patients doing on the cognitive front, but how can we intervene with the cognitive programs that Karen Miller and Dave Merrill have with their group in the dementia world to see how that impacts cochlear implant outcomes. And we really are one of the few in the country pushing this really innovative research forward. So I feel very blessed to be part of the group, and I hope that you all come in to get your hearing tested. Thank you. Yeah. Thank you.
Okay. Thank you, Courtney. Thank you, Melita. Thank you, Dave. Well, I think what hopefully you saw there from the group is I think is one of the secrets of our success at P&I is this cross-fertilization of ideas, this intermingling of programs, and we all learn from each other. And like I said, we started in the realm of brain health, of brain tumors, and now we're off into this world. And it's really, I think this is what makes P&I so unique and really so successful in how we're trying to, push the needle. One of the other people who I saw earlier, but I don't see her now, is Shanti Goinanthan, who's our psycho-oncologist. She's a psychiatrist who works with all of us, and she specifically takes care of our brain tumor patients who, as you can imagine, many of them have mental health issues, depression, anxiety, existential crisis. And so that's another program that we have that I think is very unique at P&I and really makes the sum much bigger than the individual parts. So we're going to open it up for questions. Anyone want to ask a question? I see we have microphones. If anyone has a specific question, or if not, I'll ask some pointed questions.
Hi, I'm interested in learning more about the transcranial brain stimulation.
So transcranial magnetic stimulation, it's a FDA-indicated treatment for severe major depressive disorder without psychosis. That is treatment resistant, meaning you failed one or more medications like antidepressants and also failed psychotherapy to be covered under health insurance, and traditionally have been done once a day, non-invasive. So non-invasive, you just put a magnetic applicator to the scalp and then you turn it off and on very quickly, 50 times in 1 second, and it actually has 3 waves in it. 50 times in 1 second, and you do that for, actually now it's only 3-minute treatment. It's called Express TMS, and the evidence shows that within 6 weeks, if you do that once a day, that upwards of 2/3 of patients show significant response, if not remission, to their major depressive episode. So that's been around for years now and has been, like I mentioned, it's a FDA indicated treatment, and it's covered by Medicare and insurance, and so we're able to offer that at the center for persons dealing with depression. What's also interesting is that it's basically a neuroplasticity mechanism, a way to boost brain-derived neurotrophic factor, other plasticity factors in the brain. And so we've been studying it and attempting to apply it in other circumstances, such as mild memory loss in the context of aging. So we actually now have a new protocol that I'm doing that involves stimulation of an area of the brain called the precuneus. So if you want to Google that later, oh wait, no, now you ask ChatGPT. You can ask artificial intelligence about the precuneus, and that's a part of the area in the back of the brain that relates to memory networks, and if you stimulate that, you see that there can be a memory benefit. That is still considered quote-unquote off-label, meaning that we can't, unfortunately, get any insurance coverage for it, but we can certainly do our best to provide the service. And also, I'm in the midst of writing up a study protocol for that, which we're hoping to get funding for in the near future. Does that answer some question? Good. Great. Thank you. Great question.
Thank you. My name is William Kendall. I'm a writer-producer based in Santa Monica. Patient of also at P&I of Dr. Buxton's as well as Dr. Barkadarian's. And I appreciate my conversations earlier with Dr. Kelly and Dr. Merrill. Thank you. It was good to meet you. I also want to thank Jean Goldsmith and Cookie Galanti for our conversations about the foundation. My question is there any pathway for a third generation Angelino, my father, who has PD advanced, and a son who's having symptomology that hasn't been figured out yet, to meet together with somebody, father, son, that could maybe tell us what's going on?
I'll take that. Thank you. Yes, I do have a smaller percentage of patients who have it in their family. And I have a lot of patients whose adult children wonder, or the patients wonder, about what is the risk to their children. And so it's a whole other conversation. But yes, there are genetic tests, and I do believe that with the biopsy I was referring to earlier, the SIN1 biopsy, there's evidence that people who have a prodromal phase of Parkinson's can be detected with that biopsy. So you can actually catch the biological basis of the disease before the symptoms begin, or before the symptoms have come to a point where it's clearly Parkinson's. So yes, I do have availability, so I can give you my card after. If you guys don't mind, I know this wasn't a question, but I completely forgot, and I'm so sorry, to mention the research work that we've been doing, and I think that's kind of what we were expected to mention. So just very briefly, I wanted to mention, along the lines of that biopsy, the SIN1 biopsy, we were involved with an NIH-funded study to look at how well it does in differentiating between Parkinson's disease, dementia with Lewy bodies, multiple system atrophy, and normal controls, as well as a different condition called pure autonomic failure. And so the full study results are pending, but the preliminary results were very favorable. So that was a really exciting opportunity to participate with that research. Right now, we're also participating in a multi-center trial looking at early stage Parkinson's and treatment using a tyrosine kinase inhibitor, which is like an older cancer drug, but separate from one that is meant to clear out the abnormal alpha-synuclein in the brains of people who have early stage Parkinson's disease. That one's going to get closed soon, but it's active at this time. And then we're enrolling for a clinical trial for patients with dementia with Lewy bodies, looking at a treatment that we're hoping will clear out not only alpha-synuclein, but also beta amyloid, which is part of what happens with Alzheimer's patients. So really exciting work that I wanted to share.
Hello. My name is Veronica Magar. There's a lot of really good evidence with psychedelics to treat untreatable depression, substance abuse disorder, and PTSD. Is there any interest in the group to do research with psychedelics in the areas you're working with, memory, movement disorder, hearing? Yeah. Any interest, any donor interest, any protocols being written?
We have a center called the TRIP Center, Treatment and Research in Psychedelics, that we started in 2019. It's run by Dr. Keith Heinzerling, who's an addiction medicine specialist, and we've done 3 clinical trials, 2 in major depression, and 1 in alcohol use disorder. 1 major depression, 1 alcohol use disorder, and 1 in generalized anxiety disorder. And all the studies have been very positive. And so this is a very active area. One of the things that Dr. Merrill and I talk about a lot, and Dr. Bredesen, is that all the psychedelics, including ketamine, which is available now, psilocybin, LSD, MDMA, they are all neuroplastogens. And so it makes it a very exciting time in the neurosciences and the marriage of mental health issues and neurosciences. And I think we've really just begun to scratch the surface of where psychedelic-assisted therapy will take us in terms of new treatment avenues. But there's decades of potential studies, so it's an area, yes, we're very, very interested in. Thanks.
Okay, this is for Dr. Voelker. Quick, I think easy question. Have there been any advances in hearing loss that kind of bridge the the opening between the need for a cochlear implant on the one hand and the clear ability with even current state-of-the-art hearing aids to have a one-on-one conversation and hear the person, but there's that vast area where you're in a social situation where you just can't hear anything or anyone. Has anything happened to improve that other than claimed improvements?
Yeah. This is the #1 complaint with anyone with hearing loss. So difficulty hearing in background noise. And the hearing aid technology world, cochlear implant technology world, piggybacks on the cell phone industry and the stereo industry, et cetera. So when you see advances in technologies in those industries, it's about 2 to 3 year delay when you start seeing those technologies, background canceling technologies and things like that getting incorporated into hearing aids. Hearing aids are like little computers now. They're really sophisticated. They will link into public loops. Most of the places of worship, concert halls will all have loops. And now through Bluetooth technology, those will link in. So actually, when you're in more of those types of public spaces, it's easier for folks because actually your cochlear implant or your hearing aid will loop right in. It's when you're at a wedding, with all your annoying relatives, and then you can't hear anything and everybody misunderstands what you say. You just want to crawl under a hole. That's where you really will struggle. But another thing is, when I was being trained as a fellow, you really had to have profound bilateral, both sides hearing loss to be a cochlear implant recipient. And actually, our group at PNI are involved in an expanded criteria trial where we're starting to enroll with industry patients that don't meet traditional criteria but are having just the difficulty that you say, that middle group that is not helped by a hearing aid anymore but aren't cochlear implant recipient criterias, and the criteria keeps getting shifted more and more and more over. And so that's very exciting. But you're right, it's very frustrating. It's the #1 complaint, and the technology gets better every year.
On the DAT scan, which I guess some people here might also know as the nuclear medicine scan, I'm wondering about how long would it be before you ought to get retested? Unless your name is Mustafa Siddiqui, it's a pretty expensive tool to use. So what do you think is an amount of time where you want to find out, am I really doing better or am I doing a lot worse?
Great question. It was a very specific question about one of the biomarkers that we have here at St. John's called DAT scan. Right now, clinically, we're not repeating DAT scans. It's really just being used as a binary, does this person have Parkinson's or not? There hasn't been enough correlation of the severity of the dopamine deficiency on the scan with how people are doing for it to be used clinically as a prospective biomarker. And that is truly still the holy grail, is finding that prospective biomarker, not just for clinical, but more importantly, and I hate to say it that way, but truly more importantly for research, because we need to be able to see what's happening within the brain to not just the dopamine levels, but also the spread of alpha-synuclein and other signs of neurodegeneration to know whether these preventative treatments are actually doing something before we see that clinical impact. So that's still work that's being done, like the Michael J. Fox Foundation is doing the PPMI to look for a prospective biomarker. So DAT scan isn't yet being used as a prospective.
Can you talk a little bit about the status of blood tests to determine Alzheimer's?
Yeah. Score. Somebody was listening. Great. I was hoping that question would be asked. So the question was about what's the status of taking a blood test in terms of finding out whether or not you have Alzheimer's. Is that right?
Prospectively, you're inclined to have Alzheimer's. I don't know what the blood test marker is. That's what I'm asking for you to explain, please.
Okay, for sure. So there's actually been really in the news recently. The question was about, are there blood tests for diagnosing Alzheimer's? And the question is now, the answer is, for the first time now ever, the answer is yes. But there's controversy because if you're cognitively normal, who's to say that you have a disease? So the blood tests measure any number of proteins, but the two main parameters they're looking for, and really there's amyloid beta, so beta amyloid is the main marker that's being looked at in terms of how it correlates with buildup of amyloid plaques in the brain. So amyloid plaques define the condition Alzheimer's disease. Dr. Alzheimer's in 1900 defined Alzheimer's as the buildup of plaques and tangles in the brain. And so now we have these exquisitively sensitive peripheral blood tests that are highly correlated with the status of whether or not you have plaques built up in the brain. And so with pretty good fidelity, pretty high sensitivity, specificity, you can predict through a blood test whether or not somebody has plaques built up in the brain, which would define pathologically the condition Alzheimer's. However, the caveat is whether or not you have plaques built up in the brain, there's not a tight correlation with how your cognition is. So you can have plaques building up in the brain, but you can have what we call cognitive reserve. You can basically have a positive blood test, but then be able to compensate for the fact that you have plaques building up in the brain. And so it's an emerging area that is kind of the way things are in the modern world. The testing, the technology is getting out in front of how do we handle this in the clinic? How do we talk with families, loved ones? How do you share with your relative that, like, I got a blood test that said that I have Alzheimer's, even though I'm still running the company or I'm still driving my car? So it's a fantastic question, one that we could talk about all night. But the short answer is yes, there's a blood test for Alzheimer's.
What about the tau? Does it have no measure of the tau?
So it depends on the test. There are assays for tau, and actually, so Dr. Petrossian was, not to confuse things, but so yes, there are tests for tau levels, and there's the thought that tau may be what we've been looking for in terms of a marker that you can follow going up and down. So it's the level of phosphorylated tau, which is an abnormal form of the protein. As that goes up, there seems to be a correlation with a worsening of cognitive function. As that goes down, we might be hopeful, we don't know yet. We're studying whether if we push that down, if we can get phospho-tau to lower, can we find improvement in cognition? Could it be a bidirectional? So that's where the studies really are. We were the top enrolling site. Pacific Neuroscience Institute was a top enrolling site for a phase 1 clinical trial of a blood marker for amyloid beta and phospho-tau that's going to be presented at the Geriatric Society of America conference later this year. And so it speaks to the point of the question, which is that this is very much an emerging topic, and I forget the title of this seminar, but I think that was kind of the point, to talk about the latest stuff.
Yes. Okay. But I'm getting the message. We have to wrap this up. Thank you for that important question. I will just add that I've been sitting in on some of the precision brain health, and we have something in brain health called the prevention trial, which is looking at people over time. And it's a very detailed dive. So it's not just blood tests. It's looking at their MRIs, their neuropsych testing, their diet, their sleep habits, whether or not they have hypertension or diabetes that's well controlled, their socialization. All those things go into the formula of whether or not someone has risk factors, what their family history is. And so this is a very complicated area, as Dr. Merrill's alluding to, but we have more and more tools and more sophisticated ways to assess people and to predict how they're going to do, and then hopefully ways to intervene. And I think that's really where we're making huge progress here at Pacific Brain Health Center. So I think we have to wrap it up. I am going to introduce Sheryl Bourgeois, who is our St. John's Health Center Foundation president and CEO since May. She's almost 1 year with us. She's been a fantastic addition to St. John's, and Sheryl's going to wrap it up for us tonight.
Thanks. Thank you. Thank you. I want to thank Dr. Kelly, Dr. Merrill, Dr. Petrossian, and Dr. Voelker. I hope you'll agree and are as impressed as I am to find out how comprehensive and integrated our neurosciences are at St. John's. Another round of applause for these guys. As Dr. Kelly said, I have the good fortune of leading the St. John's Health Center Foundation and a dynamic team that is dedicated to raising philanthropic support for the work that you just heard about. And I want to underscore the word dedicated, because I really do believe that it is an honor and a privilege to be able to support and to serve and advance the work that's being done. As you heard Chief Executive Michael Rick say, that their achievements are a significant point of pride for us at St. John's. Their work sets us apart. It differentiates us, not just here in the community, but all over the world. But I think we've also found that their work is also relatable. As I look around the room and I heard some of the questions, I think we can all agree or have been touched by one of these challenges, one of these conditions. I myself had a mother with dementia who had hearing loss, Courtney, and actually I think the dog ate one of her hearing aids. So I'm personally grateful for the tireless efforts and commitment that they're making to this work. But their work is not easy. Healthcare is challenging. It is complicated, and it's costly. And today, healthcare is facing such significant financial headwinds and pressures. As you heard from them and from others, philanthropy has and will continue to be an ever-increasing role in their work and advancing the work we're doing here at St. John's. I know many of you here tonight, I know many of you are already wonderful contributors, generous supporters of St. John's. Please know of our deepest gratitude for what you've helped us to achieve already. If you're new to us, I invite you to get more involved. I invite you to learn more of what we're doing and consider making an investment in their work. Your investment at St. John's and in the neurosciences, in any of the work that's being done, it'll pay dividends, I assure you. It's not often that you get the chance to change or save someone's life, and you can do that here. So thank you for listening. Thank you for taking time to be with us tonight. The night is not over. Our physicians have said they'll stick around and answer more questions. There's more wine, there's more food, so please stick around, and please come back. We'd like to see you more. Thank you.